I'm Daniel Levine, and this is the Bio Report. A growing problem with drug-resistant infections acquired in hospitals is catching the eye of Consumer Reports, which has added the incidence of 2 common and deadly infections to their hospital ratings. The ratings come in the second part of a 3-part investigation into the antibiotic crisis. We spoke to Doris Peter, director of Consumer Reports Health Rating Center, about the study, what the highest-rated hospitals are doing that the lower-rated ones are not, and things patients can do to safeguard themselves when they face a hospital stay. Doris, thanks for joining us.
Thanks so much for having me.
Consumer Reports just published the second of a 3-part investigation into the antibiotic crisis. We're going to talk about the second part of that series, which looks at hospital-based infections. Perhaps you can begin by giving us a sense of how big a problem this is today.
Well, it's really an enormous problem. I mean, we know that 650,000 people approximately develop infections in the hospital each year, and 75,000 people die with these infections.
And your new ratings take into account the incidence of MRSA and C. diff infections. These are 2 bacterial infections that in many cases are beating our current arsenal of antibiotics as resistance has become a big problem in combating them. How big a problem do they represent?
Yes, they're quite a large burden for particular reasons. And MRSA and C. diff are new in our report because enough data is now available for us to really bring it to light and develop ratings and a way to understand them. So for MRSA, there are about 60,000 infections every year and 8,000 deaths. And with C. difficile, there are about 300,000 infections in hospitals and other healthcare facilities, and 27,000 people die each year as a result. So it's a real big issue. And C. diff, I think, is now coming out as having a lot of burden even after you're discharged from the hospital, and that it's sometimes even spread once you get home to other family members. And so it's a real problem.
Well, how does the problem with MRSA and C. diff tie into what you learned in the first part of the series?
Well, it really has, the tie-in is really with antibiotics. So we have just a complete problem with overuse of antibiotics in this country, and that fosters 2 things. One is that it increases resistance to antibiotics, so that's what you see with MRSA. So you see drug-resistant Staph aureus in the form of MRSA, or even worse, another kind called Versa, which is another antibiotic which used to kill MRSA, but now that's a problem. So that happens when you have overuse of antibiotics, and overuse in terms of prescribing and also in our food. And then for C. difficile, it's tied with antibiotic use because the antibiotics are given sometimes for things that and sometimes unnecessarily, will kill the local flora in your body, and then C. difficile will colonize your body and cause all sorts of symptoms and sometimes even death.
Well, as you mentioned, you recently added this to the analysis because of data becoming available. Where did the data come for this?
Well, hospitals are required to report this data now to the CDC, and then the CDC gives it to the CMS, the Centers for Medicare and Medicaid Services, and then that's allowed out to the public now. So anyone actually can go and download these files, but what we do is we try to, we analyze the files and try to make the data understandable and comparable across hospitals.
When you look at the MRSA and C. diff rates for different hospitals, how much of an indicator are they for consumers?
Well, I think they're an indicator of what the hospital may or may not be doing to prevent those infections. So hospitals that are doing poorly on one or both are receiving one of our 2 lowest ratings. I'd be concerned that they're actually not implementing CDC-recommended guidelines for preventing these infections. So that might be, for example, antibiotic stewardship programs that reduce overuse of antibiotics within the hospital, so treatment in the hospital, and then proper hygiene, not just hand washing and I shouldn't say just because it's a perpetual problem, but also proper cleaning techniques of the rooms themselves, including curtains, like for example, washing the curtains or things that maybe are not standard.
The numbers seemed a bit surprising, or perhaps I should say disturbing. Can you give a overall breakdown of how hospitals performed?
Sure. So across the country, we had 3 out of 10 hospitals, so approximately 30%, got one of our two lowest scores for C. difficile, and 4 out of 10 received one of our two lowest marks for avoiding MRSA. So that's a big concern. And then only 6% received our highest scores against both. So that's quite disturbing. Now, if you compare that with central line infection, so that's a type of infection that's been followed for much longer, and hospitals have had a lot of time to implement the proper protocols. About 60% of hospitals get our two highest ratings for central line infections or avoiding central line infections. So you can see what's possible over time.
One of the other big surprises was that some very big name hospitals, ones people would think of as top ranked, didn't fare too well against MRSA and C. diff. What did you find?
Yes, it's true. We found actually that, for example, teaching hospitals scored less well than non-teaching hospitals, even when you controlled for the hospital size and for the urban location of the hospital. So, and teaching hospitals tend to be the ones that have names that are more recognizable. So I think that's a concern for people. And, to be honest, though, what people really have to do is look at the hospitals in your neighborhood, because you can have higher and lower performing hospitals no matter where you are. You might have one just a few miles away that's higher performing. So you really need to look at the data in your area.
Well, what made the difference? What did the high scoring hospitals do that the others didn't?
We spoke to some of them, and it really came down to rigorous control of the environment, and really even engaging the staff. So one of the hospitals had different kinds of competitions within the hospital to see which group could perform the best at preventing infections, which ones could have the best scores at hand hygiene. I've heard certainly the antibiotic stewardship programs is something that a lot of them are doing. I've heard of hospitals running programs where the staff will wear a button that says, "Ask me if I washed my hands." That's just, a real great example of trying to engage the patients and saying, it's okay to ask me. I'm not going to, you should ask. I'm sorry you have to ask, but you should. So there are all sorts of ways that hospitals can be doing this. Some of them that are not doing well, this is another way of looking at it. When we asked them about it, they said that they've joined forces with the CDC and the Joint Commission to address their problems. So they're bringing in help to help them analyze what's going on.
Well, is there a list of best practices that hospitals should be doing?
Yeah, we've put down our recommendations that are very general, but the CDC has specific guidelines as to what hospitals can do in all these cases. They have toolkits for hospitals to deploy in terms of cleaning protocols. There is for insertion of central lines and other lines, there are step-by-step checklists to deploy. And then there are antibiotic stewardship programs. So there's a lot of it out there. Each hospital, I think, has to figure out what works best, in their environment and how to deploy them. Because just because you have a checklist doesn't mean you can throw it at a group of people and say, "Here, it's going to work." There's a lot. I think it was the Atul Gawande who wrote an article about that. About the weight has to come from the bottom up, in that the staff have to measure what's going on. They have to identify the problem from themselves and then implement the solution in their workflow in order to actually get it to work.
There's been also changes in reimbursement where hospitals bear the cost of problems that take place within their walls. Does this include MRSA and C. diff infections that occur when a patient is at a hospital?
Well, as far as I understand, it's more of a penalty system where the lower performing hospitals receive a penalty against their reimbursements. It may be hard to actually tie it directly to an individual patient in terms of not paying for something. It would be good to see what private payers are doing. I have not yet heard, but maybe it's happening that private payers are also either penalizing or not paying for things.
I take it that, this is really the first time you've used this data. Is there any indication whether these types of financial incentives help?
Well, it's hard to say. The central line infection rates have gotten better over time, but the penalty system only kicked in recently. So I'm not really sure whether it was because the threat of that coming, made a change. So that would be interesting to know. Definitely they were incentivized to report. Like if you don't report, you also are penalized. So the reporting itself is part of it. And there is some evidence that when you publicly report data, then, performance will improve. So it may be a mixture of the penalties or the fear of penalties and then also the public reporting and the ability to see your data out there. That's probably part of it.
What about the patients themselves? Are there things they should do to safeguard themselves when spending time in a hospital?
Yeah, definitely. I mean, we always recommend the hand washing issue. So it's not only you, but your visitors who come in to ask them, please wash your hands, and to have them or you mention this to staff when they come in, to not be afraid to ask about hand washing. Although we know it's difficult to do, and that the majority of patients, when we've surveyed them, have if they didn't see the practitioner or staff wash their hands, are reluctant to ask. So we know it's not something people feel comfortable doing, but we know it's doable, and it likely will help. Then the other thing is asking about antibiotic prescribing, because both in and out of the hospital, overuse of antibiotics again is related to these illnesses, and the more we can do to stop that, it will help not only you personally with your condition, but potentially other people as we try to battle this overuse problem.
Doris Peter, Director of Consumer Reports Health Rating Center. Doris, thanks so much for your time today.
Great, thanks so much.
Thanks for listening. The Bio Report is a production of the Levine Media Group. To automatically download this podcast each week, subscribe to our RSS feed or through iTunes or other podcast manager. To join our mailing list, go to levinemediagroup.com. We'd love to hear from you. If you want to drop us a line or are interested in sponsoring this podcast, send email to danny@levinemediagroup.com. Special thanks to Jonah Levine, who composed our theme music, and the Jonah Levine Collective, which performs it.